Did you know if you have a bunion, you can get surgery to correct it? A bunion or hallux valgus is a deformity at your first metatarsal phalangeal joint, so the joint of your big toe. A lot of people, women in particular, develop these over a lifetime, and it can become quite painful, and cosmetically a lot of women like to get them addressed too. So you can get a surgery to address this hallux valgus, known as a bunionectomy, and I'm going to show you a few exercises I've used with a client this week who had a bunionectomy a while back to help her get back to full function and walking properly. After surgery, you'll be in a protective shoe for about 6 weeks and on crutches too. After that period, a progressive gait retraining program is essential. You'll see it in someone after the surgery, they won't want to weight bear through their first MTP. So the area where they had the surgery, they're not going to be able to get into that extended position, especially in weight bearing as well. So what we tend to see is people using a heel dominant walking strategy. So they'll take small steps, maybe walking on their heel, or else still walk on the outside of their foot to avoid weight bearing on the first MTP. You see the likes of this in people who have a sprained big toe or hallux rigidus as well. So let's get to the exercises. Firstly, we're going to have just a little bit of weight bearing mobility. After a period of immobilization, ankle dorsiflexion will be stiffer as well. If you've been to physio before for an ankle injury or anything, you're going to know, you probably have seen this before. It's just a basic knee to wall, but we're cueing the patient to try and push their knee towards their big toe just as far as is comfortable. So just trying to get a little bit of weight towards that first MTP. So you're going to be mimicking the heel strike to forefoot push off that you'd get during gait. If this is painful, or if this is not tolerable yet, you can do a little bit of support with the wall, or else just don't push as far into it. You might have previously heard about the importance of your big toe for balance, and this definitely rings true, especially after surgery like this. So the next exercise is going to be very basic single leg balance. So literally just balancing on one leg, trying to control that movement, trying to cue the patient to keep weight in the base of their big toe if possible. They'll likely want to shift over onto the outside of their foot like they've been doing when they're walking. So what we can do, we can time that, see how long they last for, and gradually build that up. And we can also add in a couple of different things. So we can add in knee bends to make it a little bit more difficult to shift a little bit more weight to the front of that foot. We can add in trunk rotations then as well, which again will make the balance aspect harder, load the inside of that foot a little bit more. Third exercise we have is going to be a seated calf raise with a bias towards the big toe. So in this position, getting the heel back in as close as you can towards the bench while keeping the heel on the ground. You're going to cue to push up through the base of the big toe, again, just as far as it's comfortable. In a lot of cases, you might only be able to lift an inch off the ground. But again, just to get a little bit of weight bearing dorsiflexion back into that big toe, because it's going to likely be quite painful while standing. Over time, then this can be progressed by adding some weight to the knee. So you can use your hand, you can add a dumbbell, and then gradually progress to a standing calf raise. Our last two exercises then are going to be more specific to the gait pattern itself. For the fourth exercise, we're going to be shifting our weight from our heel to our forefoot while using the support of the wall. So in split stance position, working leg is the injured leg is going to be the front foot. So starting on our heel, toes up off the ground, shifting forward, trying to push our hips over our big toe, coming back, toes back off the ground, dorsiflexing that ankle, shifting forward, getting as much pressure into the base of that big toe as possible, coming back up, again controlled. The better that feels, you can even lift the opposite leg off as if you're going to take a step through, come back, gradually using the wall less as we move through that. Our final exercise then, again mimicking the gait pattern slightly more. Front leg is going to be our surgical foot again in this position. We're going to take a step through, trying to push off through that big toe as much as possible. Stepping back, coming back, dorsiflexing that ankle again, coming through into as much weight-bearing plantar flexion as possible. So just moving through those two positions. Hopefully you found this little case study helpful. I'm going to be doing a lot more along these lines. So if there are any injuries, any areas of the body that you'd like me to focus on in particular, please do let me know and I would be happy to oblige. And make sure to subscribe because I'm just getting started with YouTube and I need all the help I can get. Thanks.